afternoon, everyone, and welcome to today's presentations. My name is Dr. Sarah Wilson. I'm a public health physician at PHO, and I have the pleasure of being the moderator for today's presentations. So before we begin our session today, I'd like to just take a quick moment to note and acknowledge that acknowledge that the land that we're hosting this virtual meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. And we also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So good afternoon, everyone, and welcome to today's session on COVID-19 CANImmunize clinic flow for mass COVID-19 immunization programs, the Nova Scotia experience. As I said, my name is Sarah Wilson. I'm a public health physician at PHO, and I have the pleasure of moderating today's session. So before we start with today's presentation, I'm just going to mention a few short and brief housekeeping items. So I'm sure at this stage, everyone's very familiar with Zoom, but Zoom, as you know, allows attendees to have the ability to customize your own view, and you can do so in the right-hand corner of your own screen. We have a Q&A pod, and so please use this to enter questions as these come to you during the session. And then at the end of the presentations, we'll use those Q&As to interact with our presenters today, and we'll save those to the end of the talks. And if at any point in today's presentation you have any technical issues, please email events@oahpp.ca. So it's now my pleasure to introduce the speakers for today's presentation, Catherine Atkinson and Dr. Kumanen Wilson. So Catherine Atkinson is the Chief Operating Officer and co-founder of CANImmunize and has worked with the CANImmunize project since its inception. A passionate believer in the power of digital technology, Catherine is a published expert in mobile technology and immunization. Catherine is currently a PhD candidate at the Karolinska Institute, where she's learning how to improve immunization systems with digital technology. And then our second speaker is Dr. Kumanen Wilson. Dr. Wilson's an internal medicine physician, scientist, and expert in digital health. He is the CEO and founder of the CANImmunize project, and his research has focused on public health and immunization. So I will turn it over to the presenters. Thank you very much for giving the talks today. I look forward to interacting more with you in the Q&A session. Thanks.
Thanks, Sarah, and thanks everyone for inviting us. So I want to declare our conflict of interest. As Sarah mentioned, we are co-founders of CANImmunize. So today we'll be speaking a bit about our experience in Nova Scotia. And actually, before we start, I'd like to thank everybody on this call. I know many of you have been working extremely hard during this pandemic. And traditionally, I've looked at this as an academic and a scientist, but having worked directly on this project, I've really obtained a new appreciation for the efforts that are occurring and how hard it can be and how hard it is when you get criticism. And so, looks like we're starting to see the light at the end of the tunnel, and I know it's because of a lot of the hard work of many people who are on this call. So thank you for that. The goals of this presentation is sort of to take you through our experience developing a digital solution during this pandemic, and specifically what we did in Nova Scotia, and show the importance of those digital solutions and the components of those solutions and some of the challenges we had. And then how, as we move to the next phase of the pandemic, how digital solutions can help moving forward. So I'm not sure how many of you are familiar with CANImmunize, but this is a pan-Canadian solution that's been supported by the Public Health Agency of Canada. It's available in every province and territory. We have schedules for every province and territory across both platforms, iOS and Android, and as well as on the web. It is been around for 10 years now. It's hard to believe. And in fact, when we created the original version, Immunize On, I think it was the first digital immunization solution of this kind created. And I remember at the time Apple contacted us because they were waiting for someone to do this. It seemed like an obvious thing to do. And as mentioned, over the 10 years, we've had the good fortune of working with many people in public health and iterating and making our solution better. We're recognized by the WHO Vaccine Safety Net and Health Standards Organization, to name a few, in Canada. And it's through our work with public health scientists and the broader community that we believe we can have tailored our solution to be as helpful as it can be. And here's just a list of some of our partners, and these are growing. We are grateful for their support through the years. There have been some challenges, as many people here know, in launching digital solutions, and it does require patience on the part of partners, but often that patience is rewarded. So very briefly, this is how the app works. You create you create a profile, you put in your name, sex/gender, as well as date of birth and province, and it creates a schedule. It's designed for all age groups, but initially the largest use case was for pediatric vaccinations, and we designed it to have visits as per the well baby visits checkups. We've been in the Ottawa hospital for most of this journey, but at the beginning of last year, we took possession of the product as a private company in order to ensure that we could develop a sustainability strategy for the product. And then, of course, soon after that, the COVID-19 began, and we saw the opportunities for how digital technologies could help with this pandemic. And we recognized that the vaccine rollout was coming, and it would be one of the most complex mass health interventions in our lifetime. And here are some of the challenges we anticipated, and it appears that they have come true. So vaccination tracking, we need to be able to know at an individual level what vaccines individuals received. This would help us then roll this data up to have population level coverage data, as well as inform safety and efficacy analyses. We realized that there'd be an importance of detecting and monitoring adverse events, and we did a pilot study with the Canadian Vaccine Safety Network to build the capacity for mobile reporting of adverse events in CANImmunize. And unfortunately, the relevance of that has become apparent with some of the vaccines. Distinguishing vaccines, this is an unusual rollout in the fact that multiple different products were out at the same time. They all have different profiles, both from a safety and efficacy perspective. I think an issue that's going to be upcoming is series completion. It's not a given that everybody will come back for their second dose, particularly as the schedules change and the recommendations change. In the US, I think there was a 10% drop off for the second dose, and that was with a 3-week gap. So using digital reminders will be quite important. And we've also become aware that eligibility requirements are constantly changing, and this can be very confusing to individuals. So anything that a digital platform can do to facilitate and help people through this process would be valuable. And just we came at this from the perspective as scientists and academics, and this was actually a paper we published prior to the pandemic about the digital immunization system of the future. And how the various components could link together. And I think that's what we're starting to see emerge out of this. And this was a paper we actually wrote in 2016 about digitizing immunization records internationally. And we took the case of the yellow fever vaccine and how it could be digitized, and how a public trust network using public keys could be developed to allow individuals to cross borders. And our brilliant CTO, Cameron Bell, came up with this public key methods, and it looks like the WHO has actually recommended this approach for COVID-19 vaccine certificates. I'll hand it over to you, Catherine.
Thanks, Dr. Wilson, and to Dr. Sarah Wilson for the introduction. We're really happy to be here. I think the last time we were speaking at Public Health Ontario, presenting some initial findings of parentally reported vaccination records with Ottawa Public Health. So it seems in some ways like just yesterday, and in other ways a million years ago. Certainly for everyone on this call, the challenges on this slide are obvious and things that are being lived every day. But when we began designing the product that was implemented in Nova Scotia, these were sort of different challenges that immunization campaigns weren't facing in the past, and especially around physical distancing and having people not touching every single clipboard and pen and paper within the clinics to fill out consent and to get the immunization record. So more than ever before, there's an emphasis on our side around smoothing out some of the logistical components around scheduling, collecting that consent, and issuing immunization records. keeping people apart in the clinic, and controlling flow of people with appointment bookings was obviously also very important. And then making sure that we are capturing information at a granular level to contribute to some of those challenges that Dr. Wilson was describing around immunization record keeping, AEFI reporting, and eventual certification of immunization records. So that's how we began developing CANImmunize clinic flow. And it was initially actually launched with Briere Hospital here in Ottawa and another physician's clinic in flu season. So that was sort of how we began this journey, designing something that was everything from appointment booking and the patient journey through to documentation of the immunization and distribution of the receipt, as well as having modern APIs to integrate this data with existing systems. There's been such a massive investment in public health infrastructure in Canada that we wanted to be able to work and enhance that instead of trying to replace it or adding an additional system. Additionally, real-time data reporting and analytics was going to be more important than ever before. And I think looking back, this is probably one of the biggest takeaways, was that having that real-time comprehensive view of how the rollout is going, how your inventory is moving, allows you to make really quick decisions about how to change current recommendations and policies. As always at CANImmunize, we have an amazing team that is always user-focused and trying to make these systems easy to pick up and utilize without a lot of training or onboarding. And then lastly, coming very soon, to leverage the CANImmunize public platform to get that information back to the individual in a comprehensive manner. So what we ended up designing is called Clinic Flow. So we are fully live and working in Nova Scotia, as well as using aspects of it in Yukon and PEI. On the left-hand side, you'll see sort of the back end, our database, the secure repository, where we've been storing immunization data for Canadians for many years. All of the scheduling components, which everyone on the call again knows how painful it has been to set up and move appointments and capacity for the public to book into throughout the campaign. All of the forms and consent, so being able to customize and evolve the consent forms based on what products are on the market, the current evidence for safety and efficacy, as well as, again, collecting those demographic factors that give you insights into vaccine distribution and equity. Clinical documentation, so actually having the immunizers and greeters in the clinic be able to check patients in, document the vaccine and any clinical notes, and then back to policymakers in reporting, and of course, as always, back to individuals for their own record keeping. So you can really think of Clinic Flow as three main pieces of technology that come together to offer all of those functionalities. The first is what we call the admin console. So it's a web-based platform. So you basically go to a website and log in with your two-factor authentication. And here's where you can access all of the information about the campaign, set up your booking pages, your clinics, link immunizers to clinics, generate reports, that sort of thing. We have a whole suite of roles and permissions. So different people, as they log into the admin console, may see different things depending on what your authorization level is. The second piece of technology was always mobile first, something called clinic mode. And those are the pieces of technology that immunizers and greeters actually in the clinic are utilizing to view appointments, the forms that patients have filled out, setting up the products at the beginning of the day, and actually documenting the patient immunization or decision not to vaccinate. And the last chunk of technology is all about the patient. So that's how you find your appointment, book it, complete all the forms, get your immunization record, as well as your forecast and recall reminders for your next dose, or this week, as Nova Scotians are feeling, the opportunity to accelerate and reschedule your second dose much sooner. And our goal here was always to have it on the roadmap to be compatible with CANImmunize. We're so grateful for the Public Health Agency of Canada's investment into the CANImmunize public platform. And we want to make sure that any of the incredible work going on around the COVID rollout really feeds into that and continues to be a central source for Canadians to manage their immunization records. So if you haven't seen this amazing dashboard, I just grabbed the screenshot shortly before the presentation. The government of Nova Scotia has compiled data from many systems, including CANImmunize clinic flow, to display these statistics daily. So you can see right in the middle that age group coverage by dose. That's data that's all coming from CANImmunize and aggregated with other sources. So again, as part of our journey with Nova Scotia is really about how do we get the information to policymakers as soon as possible? And from there, they're getting it out to the public. So if you're ever curious how it's going after you hear us talk about all the complexities of the rollout, you can always go to their dashboard. So just a little snapshot of sort of to give you an idea of the scale. I know in Ontario, we have a much bigger population than Nova Scotia. So it's about 1 million people. And every single vaccine that was administered and will be administered for the COVID rollout in Nova Scotia is being done through CANImmunize clinic flow. So in the admin console, that first piece of technology I was describing that helps organize and set up clinics as well as do data analytics, there's about 2,000 users on there. Amazing project partners at Nova Scotia and the Vaccine Information Technology team who are actually setting up all the clinics and doing the day-to-day organization. There's, of course, individuals from the CANImmunize team, especially from our support desk, who are in there as well. Each clinic has the opportunity to have admins there as well, so they can quickly change availabilities or perform other tasks. Then they've also set up a call center, 811, where individuals who might not have the correct credentials to utilize the online system can call, and the 811 call center can override certain functionality and make sure that they're booked in. So we've got about 2,000 different individuals using the admin console. And then on the clinic side, you see there's about 3,300 immunizers and about 2,000 greeters across the province who are using the mobile first tablet applications to manage flow in the clinic. And I think this number is a little bit outdated since the rollout's really accelerating, but we're about 700,000 immunizations administered so far through clinic flow in Nova Scotia. One really cool thing that we developed in partnership with Nova Scotia was around an organizational structure that's inherent throughout how clinic flow works. And that's all about giving the right people access to the data they need when they need it. So we've organized everything, and all of our clinic flow customers can customize this, but there's always an owner, and under that, organizations, under organization or org type, then organizations and facilities. So if you were at a specific long-term care home, you could view everything within your organization, but nothing above it. So it really allowed for fine-grained access control while not impeding access to data that was important to move forward clinically. Another little picture is to give you a sense of scale of sort of what we've been able to work together with Nova Scotia on. These are all the different organizations that are using clinic flow right now. And I wanted to particularly point out the pharmacy use. So right now we have about 400 pharmacies using CANImmunize clinic flow to vaccinate. Another 20 primary care practices, the First Nations communities, as well as long-term care, mobile clinics, and public health. So it really is being utilized across several different service delivery locations, but everything is standardized and housed in one system so that people can rebook across service delivery locations, and there's consistency in how data is recorded and accessed. Wanted to quickly take you through sort of our journey. I can't believe it's been this many months, and again, feels like also been a very, very long time. We kicked off with Nova Scotia exploring how this might work in November, and then we officially begun the implementation in December. Our first long-term care immunizations in clinic mode were done in January. In February, the healthcare worker clinics with Pfizer kicked off, as well as 80 plus. We had several issues as we went to larger number of appointments at first with the system, but then it really hardened. So some dark days in February. And we had our full support program launched at the same time. In March, we launched the First Nation community clinics, as well as the pharmacies were all onboarded, and the age brackets continued to decrease. Public clinics through April, including outreach clinics, happened then. And then in May, drive-through launched, which was very cool. I'm not going to take you through these details, but just to give you a sense of how many technology releases it took to consistently meet the needs of a changing rollout. We are doing at least one a week. We keep trying to go to every 2 weeks, and sometimes we have multiple releases a week. And I think this really speaks to the importance of partnership. When we begun this project with Nova Scotia, it was very unclear what the pace and direction of this rollout was going to be. So they engaged us in a co-design partnership model so that as new information came to the table or new service delivery use cases came up, we were able to continue to adapt and iterate on the product to specifically meet their needs. But I think we're quite tired. So I'll take you through a little bit further into the technology itself. So these are the menu items in the admin console. So again, that's the website that administrators and clinic admins can go to actually set everything up and view the data. So you have the repository, so that's all of the patient's information, as well links out to the appointment tab. So you can see it either by clinic or calendar, or actually by an individual patient. Cohorts are groups of people that are known, whether they're people you're inviting to a specific clinic or residents of a long-term care facility that are basically being booked for that individual, as opposed to people who book for themselves. Campaigns. So although we have been really focused on the COVID-19 rollout, this technology was developed initially in the influenza season and is quite adaptable for several different types of mass immunization campaigns. So for school age programs, for influenza, or for COVID, so you can run all individual campaigns through that tab. All of the booking pages, your reports, and then organizations and clinics are about organizing those hierarchies, as I said. Forms, so lots of different consent forms over the last couple of months. All of your users, and then vaccine terminology, which we'll come back to. This is just a screenshot of our user acceptance testing environment in Nova Scotia. So you can see if you were to view your booking pages, you'd see each of them, the eligibility, the status of the booking page. So we have the ability to make it active, staging, so you can see how it looks like, password protected for various reasons. And then you also have a flag for whether there's appointments left or not. And then from there, you can make duplicates of the booking page, view things, or change the settings. If you were to look at a specific patient in the repository, this is what you're going to see. So you can see all of the demographic information, and these are matching and non-matching variables against the Nova Scotia Client Registry. For their immunization record, you see the doses administered as well as the forecast with the trade name as well as the generic concept. From there, you can print the record, send an email back to the individual, or reforecast them, which is certainly a regular occurrence these days. And then you can view the appointments that are booked this series and whether it's completed or not. Similarly, if you were to drill down into that individual's appointment, this is the type of information that you'd see. Want to kind of take you through step by step a bit of the patient experience before we go through what an immunizer sees. So this particular page was developed after we initially launched in response to public feedback. So that's been another huge advantage, I think, of how Nova Scotia's approached their vaccine rollout and their engagement with us as a technology vendor is they've been very responsive and listening to public feedback. And initially they said it was really hard to find clinics near you that had capacity to vaccinate under certain circumstances. So we built a postal code or an address lookup that, based on your physical location and your age group, can give you a filtered list of locations where you can receive an immunization, whether there's still appointments available and how far it is from you. Once you select your clinic, you land on a booking page, and this is just a template. All of the content is customizable. So right through the admin console, if you want to change some instructions, tell people to bring something different, or link to different information sheets, that's all customizable. From there, you can actually select your appointment and your time, and then it brings you into the intake process once you've reserved your appointment. So in Nova Scotia, they've elected to have individuals match against the client registry based on health card information. So that not only verifies the eligibility of the individual, but their identity. And then it brings you through the health status and consent form for immunization. I also want to include some screenshots of the Yukon workflow because I think their branding is incredible, and really proud of the partnership there. Similarly, you can see the same type of template, but customized for individuals living in the Yukon. This slide shows some of the patient confirmation communication. So again, these are just taken yesterday. So we're in the midst of inviting individuals to either book or reschedule their second dose based on accelerated scheduling. So when we began public clinics, all the intervals were set to 105 days, but as everyone is living on this call, that interval is being shortened very quickly, and so grateful. It looks like we're gonna have a 2-dose summer. In the middle, that's your appointment confirmation. And again, you have the opportunity to manage your appointment right from that link. And the last email on the right-hand side is the email you get once you leave your appointment to access the digital immunization record and participate in the Canvas safety survey. So we've been able to link that through the email, a super low-tech way to boost enrollment rates in a really important safety surveillance program. We explored some higher tech and more complicated ways of passing off credentials, but based on how quickly the rollout was moving, it was decided to try just a button in the email, and they've exceeded enrollment already. So sometimes a low-tech solution can work just as well. I think that was another really good learning from our project here. So when you click the Access My Digital Vaccination Record button, it brings you to a landing page to put in some additional authenticators and access your immunization record. One of the things that we found challenging about working remotely with partners that we've never met before is it's kind of tough to know if things are going well. But thank goodness for Twitter, because they will let you know right away how they're feeling. And again, it was great feedback and constructive information on how the technology and the rollout could better serve individuals. And just this morning, it was great to see last night when we started sending out emails to rescheduling appointments, we were able to get real-time feedback that it was easy to do so and people were successful. Not only that we were seeing those metrics in the back end, but having that public feedback. So although it would have been great to be on the ground and working with partners and with Nova Scotians, there's been some really creative ways to collect feedback as well. One of the things that is on the immediate roadmap in our partnerships in the Atlantic provinces is to find alternative ways of getting people their immunization records if they hadn't necessarily provided an email address at the time of sign up and booking. So we're launching a public-facing portal that, based on custom sets of authentication details, individuals can actually retrieve their record from clinic flow. Certainly, as we're hearing Atlantic travel ramping up at the end of the month so that people could go to their cottages in different jurisdictions if they had proof of immunization, this is a big priority. Very similar to how it would look in the CANImmunize public app, you'd be able to view your record. And as public health nerds, we've got the generic concept, your trade name concept, your lot number, which loops back in the back end to the expiry date, and then date of administration. So that's sort of what it looks like from the patient experience. I know I'm going quickly through this, but the next piece that I want to take you through is the Immunizer and clinic experience. So we actually built all of this into the CANImmunize public app. So you might see, if you were going to log in as a clinic flow user, turns out might not have been the easiest thing to do from a user experience perspective, but live and learn. It's all standardized and set up well to do FHIR-based messaging. And again, that fine-grained access controls apply here as well. And I'll take you through how that works at the clinic level. And then we have greeter mode and immunizer mode. So greeter mode is really about controlling traffic in the clinic, checking people in, getting ahead of no-shows and ability to mix up inventory. And again, limiting personal health information access to individuals who may not really need it. So we've been able to limit the PHI available here, and then they can scan barcodes from the appointment confirmation for contactless check-in. As I mentioned, that same organizational structure applies in the immunizer context. So you actually link an immunizer to clinics, and you can also link cohorts to clinics. So one immunizer may log in and see just a very select group of individuals if they're immunizing at long-term care, or a public health nurse who's immunizing at a large clinic would have access to all the patients in that clinic for the next 3 days. So we were able to, again, manage the level of PHI that was accessible to individuals through this organizational structure. This is what it looks like about 2 months ago when you launched your patient roster. So you can see the individual, their age, whether their COVID screen was complete or not. So green is good, red not complete. If you screened positive for any of the COVID screening questions, your appointment was canceled, so you wouldn't actually be here on the roster. Similarly, if your consent was completed, you get this check mark, and if not, the little red exclamation mark, and then you can see the appointment scheduled time and whether they'd been checked in by the greeter and an action to begin. When you go into an individual's profile, you see their forms, so that's each of the checked boxes that they are complete. And then on the right-hand side, you can see red and yellow flags. So those are responses to consent form questions that require healthcare provider consultation. So those can be viewed and a conversation can be had with the patient about the eligibility or the consent flag in question. And then you have the opportunity at the bottom to either proceed with immunization and to document your decision notes, or decide not to immunize and similarly do that. So we've been able to capture that as well as any reported AEFIs right from the tablet for really quick collection of this important information. So when you actually go to administer the vaccination, it's about 3 clicks. So you have your product information that's all supplied by the Canadian Vaccine Catalog here, preloaded at the beginning of your clinic. You just select the site, confirm everything, and press confirm. And then that individual will receive the immunization receipt, which I'll show you next. I just wanted to quickly flag a couple of kind of quality controls that we developed throughout the process. So as I mentioned, all of our variable product data and terminology comes from the Canadian Vaccine Catalog. There were some instances where clinics claimed they had immunization products and specifically lots that weren't in the CVC. So we had the ability to add custom lot numbers, but in most cases, those were actually typos, and we had to go back, do cleanup jobs, and actually work with the distribution centers to ensure everything was well aligned. And then, of course, on the right-hand side, we have various safety controls. As I mentioned, we have multi-factor authentication as you log into the admin console, and you have to verify your email address for all the immunizer accounts. So sorry, as I mentioned, once you confirm the vaccination, the individual gets the thank you email and access to the digital immunization record, as well as opportunity to submit the Canvas safety survey. As we've been storing and transmitting personal health information and immunization data for several years with public health, we have a variety of security and privacy programs in place. From a security perspective, all of our data is hosted in the cloud on AWS in the Canadian data centers. We have firms that work with us on security monitoring and maintenance. With Nova Scotia, TRA and pen tests were performed prior to launch, and there have been deltas as well. And then all of our programs align with kind of industry best practices in ISO. And then Cameron would definitely be best to speak to all of our alignment for standards, both in messaging with things like FHIR, as well as all of the authentication standards that are emerging as becoming very popular right now. Before we wrap up, I just wanted to talk about the Canadian Vaccine Catalog a little bit further. I know there's a lot of public health professionals here on the call. So the Canadian Vaccine Catalog, which we operate with support from Canada Health Infoway and the Public Health Agency of Canada, is the source of truth for vaccine information, both terminology and variable product data in Canada. The working group meets once monthly. You don't have to be part of the working group to use the CVC, which is available through APIs as well as human readable flat files and the Explore site. But if you are interested in joining, they meet once monthly, get ahead of new vaccines being licensed, ensure we've got the terminology, as well as all of the supporting data element standards so that you're capturing data in a standardized way in all the systems. Certainly, as we approach immunization certification and validation of that data, internally, like domestically and internationally, these standards become more and more important. So send us a note if you're interested in learning more, but certainly take a look at the CVC and on InfoCentral, the working group membership. Basically with the CVC, we take several data sources, including the DPD at Health Canada. We get all of the lot and expiry data, especially for COVID, as the vaccines are arriving in the country. In partnership with Infoway, we maintain the SNOMED CT terminology. All of the GTIN and variable product data comes from GS1. And then we have incredible experts, including Dr. Sarah Wilson, who participates in helping determine the new terminology and hierarchies between products to create requests for change as new vaccines come to market. And as I mentioned, all of this data is available in Excel workbooks through an HL7 FHIR API, as well as on the website. And this is really not only powering ClinicFlow, the CANImmunize public app, and other consumer systems, but as part of the reference implementation of Panorama, and can power any EMR or immunization system. So before I hand it over to Dr. Wilson, we've been working the last kind of couple of months on where we see the next step of the reopening going when it comes to sharing and maintaining vaccine information. And it's tweaking a little bit, becoming CANImmunize at work. And this is all about reopening workplaces and enabling individuals to share their vaccination records more efficiently. I don't know, Dr. Wilson, if you'd like to take the group through the science a little bit.
Sure. So thanks, Catherine. There's been a lot of discussion on immunity certificates, immunization passports. I admit I may have been a bit guilty in getting that going, but there might be a simpler way to do this that can protect our populations. And the basic idea is there is a least restrictive approach, which we're already sort of using right now in hospitals and in school-based systems. So unfortunately, we learned during the third wave that workplaces were an epicenter for COVID spread, and individuals would get sick at the workplace. They would come home and families would get sick. And obviously, a lot of healthcare workers saw the impact of this as entire families would come in. As we are getting out of this, we need to make sure those workplaces stay safe. And instead of requiring vaccination for people to go to work, another approach could be that individuals just need to submit their vaccination status, and the workplace would be able to track vaccinations at the individual level and at the geographical unit level. And then if there is a case of COVID associated with the workplace, they could notify those individuals who have not submitted a record that this has occurred and that those individuals should stay home. And this, again, is the approach used for influenza vaccination in hospitals at present. And essentially, it's the approach used at school. You can get an exemption to send your children to school, but if there's a case of measles at school, they ask your child to stay home. And the focus there is to protect the individual who's not vaccinated. So it's not punitive, it's actually protective. But in the process, you'll protect the workplace and you'll protect society, the broader population for spread of the disease. And then on top of that, we can, there are additional advantages. So, in the literature for the flu vaccine, we know that a 10% increase in influenza immunization rates reduces workdays lost by 10%. Catherine led a systematic review meta-analysis that looked at digital reminders, and you can increase vaccination rates by 20% and series completion by 55% actually with simple digital reminders. And we are increasingly aware of the importance of 2 doses. Early data out of Ontario shows that 2 doses increases your protection substantially for the existing variants, and now with the Delta variant arriving, it's pretty apparent that 2 doses are needed. So these digital reminders are going to be critical, and then moving forward, there will likely be boosters that people will need to be reminded about. So just to reiterate again, this is nothing radical or new. This is basically the standard of practice right now in hospitals and education, and we think it'd be something that could be easily used to support the workplace. Catherine, do you want to take it from here?
Sure. So as I mentioned, this is really just in the design phase, but we were looking to leverage the workflow that we had with parents reporting school-age children's immunization records to public health through the CANImmunize public app. So in this case, we'd be allowing companies to sign up to be a Connect partner on the CANImmunize website. The company could then invite their employees and decide exactly what pieces of information they'd need to reliably identify those individuals and to assess vaccination coverage. They could then, employees use the CANImmunize public app, complete their records, and ask CANImmunize to send it to the employer. The employer could work through that information, as I know many public health units do daily using the fix, and then have a dashboard to monitor important statistics to power those decisions Dr. Wilson was describing. So in this case, if a COVID-19 outbreak is associated with the workplace, the system could easily and quickly disseminate communications to individuals of various vaccination statuses with instructions about next steps. So we're in the process of developing a prototype of this and speaking to a few partners about a pilot this summer, but our vision is this would be a self-serve product. You could go on our website, sign up, consent to the terms of use as well as input payment information. From there, you could configure the system and those data elements that you need, as well as launching your connection. Individuals who are associated with your work, Immunize public application, document their immunizations, upload proof of immunization. So, currently there's several forms, whether it's a PDF that comes in email or paper form. Certainly in areas where CANImmunize is involved in proof of immunization, this could be a more seamless process, but no reason why this couldn't work all across the country with alternative forms of immunization proof. So that would be uploaded there along with, you'd be able to select your company alongside different partners that we work with already to transmit immunization information. And then we'd be able to flow that data across. The company would be able to view it in a modified clinic mode admin console and view stats that are important given the context, whether it's coverage in a particular facility or geography or department, depending on how your manufacturing facility or fulfillment center is laid out. And then, as Dr. Wilson mentioned, a crucial part of this as we enter second doses and approach third doses and potentially additional boosters is having that communication mechanism and the ability to deliver recall reminders or requests for that proof of vaccination digitally. So that could all be done through the console as well. You'd be able to see your staff list, anybody who did consent for this information to be shared. They all have Cameron's email in this mock-up, but any authenticating details that you need, whether it's an employee number or another piece of data to match them to your HR repository, could be collected here. And as we mentioned with the investments into public health infrastructure, we recognize that There's, first of all, a need to move very quickly to provide systems to enable better vaccination tracking, but often companies have an HR system and provinces have an immunization repository. So we've taken the approach of making APIs available so that this data could flow seamlessly between or within existing systems. So we're not replicating effort. And again, trying to move very quickly to support the reopening and safe return to work. Dr. Wilson?
And just to reiterate the point, we think this is sort of a least restrictive measure that preserves the rights of workers while at the same time maximally protecting their health as well as preventing spread to the community, and also brings protections to the workplace. So immunization certificates and such are being considered, but this we think could be an earlier strategy and less controversial, and it's really an occupational health solution. I'll just like to summarize by some of our learnings through this journey. And again, I said I'm primarily an academic and a physician, so this has been a new experience for me. And I think the first learning is this is really hard. My team has been absolutely incredible in what they've been able to do in such a short period of time. We started off as 5 or 6 people on our team. We've rapidly scaled to be able to deliver this. I would really like to emphasize the importance of partnership and how great Nova Scotia has been as a partner. This is their design and it's receiving accolades, and they deserve the credit for coming up with the way to do this, the centralized system, and they've guided us every step of the way. That's something I sort of come to appreciate through this process. Science needs to drive the design. Public health needs to work with the tech sector closely. I think that's an advantage we have, having a bit of a science and public health background. This is fundamentally an agile process. By that, the product is always changing. As Catherine mentioned, how many rollouts, how many releases we have, almost one a week. And that's really important in this situation where the rollout is constantly changing. Coming from an epidemiology lens, you like to do randomized trials or ecological studies. You just can't do that here. It is difficult to formally evaluate these strategies. And from a coding perspective, technology perspective, it either works or it doesn't. If the site gets overloaded, it stops working, and when it's working smoothly, you see that as well. I think an important point here is this has been a crisis that Canada has responded to, and it's identified shortfalls in many areas. But it's also forced the development of solutions that we probably should have had already and will need moving forward. Allowing people to access their health records, connecting health systems. And here the use case is immunization, but we think that this fundamentally could change the approach to healthcare and health information and getting health information to people and making it portable. We're hearing about digital identity strategies across the country that are coming up that could facilitate this. But we are optimistic that there's more positive that can come out of this. And we'll stop there and thank everyone again for being here and for their efforts through the pandemic, and happy to take any questions.
Wonderful. Thank you so much, both to Catherine and to Kumanen, for the excellent talks. It's been fascinating learning about the system used elsewhere, and then also really appreciate sort of the highlights of what might be in our future in terms of thinking about immunization in the context of occupational health, as you say. So we're going to move on to the facilitated Q&A session. There's just been a couple comments in the Q&A pod, so certainly invite the other participants on today's call to add in your questions. So I'm just going to go into the chat pod here. So there's one question here that it seems like it might be from someone who's experienced with your system. So one of the questions is, why do you not offer to sort appointments based on the first available date instead of distance? For example, some people may be willing to drive. So just wondering if you can answer that specific question about the functionality.
Catherine, do you?
Sure, absolutely. I feel like I've gotten to know a map of Nova Scotia very well throughout the past couple of months. And oftentimes there was a lot of clinics geographically clustered and then fewer in rural communities. So the priority that we heard from the public and from the team within Nova Scotia is that geography was a primary importance. And particularly as we begun with older populations, the ability to travel or the willingness to travel was somewhat less. So that was the priority that we were given, but agree, certainly as we get to lower age groups, the willingness to drive far for the quickest second dose or even first dose is there. I know I'd go pretty far to get my second dose earlier.
Okay, great. And then the next question is from, seems to be from someone in Ontario. So it says, for our colleagues in Ontario who are mandated to use Panorama to store immunization information, how does or how would the clinic flow communicate with Panorama?
Absolutely, Dr. Wilson, do you want me to start off on
Sure.
this? So the way that it's been structured, and again, this is the design that Nova Scotia has moved forward with in their instance of Open Panorama, is that nightly clinic flow provides an extract that is consumed by Panorama. So it remains the source of truth for immunization information in the province, and certainly the functionality within Panorama as a public health information system far exceeds what clinic flow has in that regard, and we offer much of the forward-facing kind of mass immunization campaign features. So in this sense, we see clinic flow feeding Panorama and enhancing the capacity for sort of that end-to-end solution. So the data is uploaded and Panorama remains the source of truth.
Okay, great. Thank you. And I think probably in relation to the enormity of the task that you've undertaken, there's a question with some curiosity about your team. So can you comment on how big the team is and where you're based?
Absolutely.
Okay.
Oh, go ahead.
Sure, I'll start.
Sure.
Catherine has the detailed knowledge, but I think an interesting part of this, before we started, we made a decision not to have office space, and some people said that means we're not really a company. Obviously, we were trendsetters in that respect, but it really did benefit us in the sense that would have been a hard thing to maintain during the pandemic. But we are highly decentralized. We've learned how to effectively work using a lot of the technology that everybody's using now, and we have employees throughout the country. We have Toronto, Alberta, BC, Nova Scotia, New Brunswick. So it's sort of, I think, the model moving forward, and it's been I think a great, a great experience. We are up to about around 30 employees, both full-time and contractors now, and rapidly looking to hire more. It's hard to find developers. That's what we've learned.
Okay, that's great.
Yeah,
That's
I'll just
great.
say we have the most incredible team, and also the team that we've worked with in Nova Scotia has been incredible, and my dog is barking. We've been really fortunate.
And I'd just like to also give a few more shout outs, if I may. Like OPH, Ottawa Public Health, was an incredibly important partner early on in developing the functionality to flow data from CANImmunize to the immunization record systems that they had. I think that was one of the first times that occurred anywhere. They were very patient with us. Again, you need to have patience to work through these type of technology changes. And Briere, the hospital that allowed us to pilot CANImmunize clinic flow type solution, was also incredibly valuable. And I think when we look to how these things need to work, I think that pilot phase and seeing what the problem is, working with the partners who are on the ground, creating the pilot, testing it ideally before the crisis hits, and then being ready to adapt for the crisis.
Great. So it certainly invite other participants to add their questions. And as we wait for some more questions to come in, I'm going to take the moderator's privilege here and ask a question. So one of the things I'm curious about is just, I think as Kumanen's mentioned, in terms of, where the workforce is in terms of a number of provinces. And I think we've also observed that, people are living in different places, even different provinces than their, maybe their permanent residents. So I'm just curious about, as people, hopefully in the fall and looking into the future, if there is mobility even within Canada, moving from province to province. Can you tell us a little bit more about sort of how you envision the exchange of immunization records? So is this something that could be done immunization registry to immunization registry from a tech-based solution, or even if you could comment now on what's happening in Nova Scotia, if you have, for example, snowbirds coming back from Florida showing paper-based copies of their Pfizer vaccine administration, how are you handling that particular instance in a very kind of mobile system, but people showing, sort of more traditional forms of documentation? So wondering if you can answer that sort of
I'll start
specific
high
question in the
level.
sort of future
Yeah.
state. Thanks.
I'll start high level, and Catherine can talk about how we're actually planning to do this. So, I think we're all waiting for sort of supranational guidance. The WHO is putting out their standards, the G7, the EU is emerging, and I think Canada wants to align with those. And there are three components to that, and it's a minimal data set, some kind of unique identifier, and a trust system. And that trust system is probably going to be a public key system, but we're not sure. So Canada, federal government will likely align with something, hopefully. And then the provinces will probably try to align with what the federal government's doing. But as you know, a lot of the work to do this happens at the provincial level, which creates a real challenge. And there is also an opportunity for people like us to then help, because we are working at the provincial level. So obviously, the first thing that came to mind is, even in the Atlantic provinces like Nova Scotia, PEI, can we facilitate this, the movement of records to allow travel and maybe overcome quarantine issues? But even prior to this, we were thinking CANImmunize could have played that role, because when we created CANImmunize, we basically created an international app, because every province and territory, as you know, has their own schedule, own vaccine information systems, own way of coding vaccines. So we already built all that functionality in, and then we were looking to see, once we connect with one immunization repository, can we pull that information and allow people to move in and send it, and particularly with panorama style registry, where the team has a lot of understanding of how they're designed. Catherine?
I think you did a great job covering it, and I truthfully was looking at the question in the chat. But certainly, I think we're anticipating federal guidance on a standard for recognizing immunizations administered in different Canadian jurisdictions, as well as with international partners. I think one of the exciting opportunities from our point of view has always been the role of the individual in managing this information. And while I think repository to repository communication is a very efficient manner and builds in a lot of that trust and authentication, there tends to be practical issues with doing that quite quickly. And in addition to data sharing agreements and everything, it requires standardization. So everyone should use the CBC. So if individuals can at least help move that forward, and the individual and be at the center of that communication while the other pieces come together, then I think that might be one potential approach, but we're all kind of waiting to see what the federal government says.
Okay, great. So we just have a couple minutes left, so we'll go to a question here around, it's a follow-up question to the earlier question about Panorama. Says, Catherine mentioned an upload at the end of the day. Would this be done through Fix, similar to the CANImmunize application upload into Panorama?
Thanks, Dr. Wilson. So in Nova Scotia, they've actually done a Move It job. So IBM has built an interface for the upload to go directly into Panorama, given that these are clinician-entered immunizations and don't require any adjudication. They're entered directly into Panorama through that Move It job. I think the Fix is so incredibly useful when you're looking at disparate sources of immunization, and that it requires that clinical review. So certainly if we were getting into patients submitting self-reported immunization records, or records from additional jurisdictions, then that would be a really good way to do it. I'm not sure that Nova Scotia has the Fix. I think Ontario and BC are still leading that charge. So there might be more use for that, but currently it goes right into the repository.
Okay, that's great. Thank you so much. Okay, so I just going to, I think, close today's session since we just have a couple of minutes left. Really want to send my sincere thanks to both Catherine and to Dr. Wilson for presenting. It's been a really fascinating session today, and I think really opening our eyes to also, what the future might look like in terms of our future work related to COVID-19 immunizations in sort of a different sphere. So thank you so much for the excellent presentations. And then I just want to remind everyone who's dialed into today's webinar that to access past presentations and view upcoming sessions, please continue to visit our PHO website, looking at the education and events section. And lastly, for those of you who've joined us today, you can expect to receive a brief and anonymous survey that will allow us to receive your feedback on today's session, and we'll invite you to provide comments and suggestions for future sessions and to improve our programming. So thank you again to Kuminen and to Catherine, and I wish everyone a wonderful day. Thanks again for joining us. Bye-bye.